just cranial to the pelvic girdle, just cranial to the pubis. And then they push a pocket or evagination of the abdominal wall down into the scrotum. And that pocket is the cremasteric pouch. And that cremasteric pouch contains the testis and the epididymis and then all the tubes and structures attached to that testis. And as they push out through the abdominal wall and descend, they form a canal, the inguinal canal, that has an opening up here in the abdomen. And you can see these tubes going into that opening in the body wall. And that's the aperture for the inguinal canal, the superior or internal aperture where it opens up into the abdominal cavity. And then the canal opens up into the scrotum, or the cremasteric pouch down here at the other aperture, the external or inferior aperture. And so the genetic pathway, or the not genetic, but the reproductive pathway is superficial. It's outside of the pelvic girdle, and it goes into the abdominal cavity, and then it comes back down behind the excretory system and dumps into the urethra, dorsal to the urethra on the dorsal side. And so you can see around each of the lateral ligaments there is a tube, the vas deferens, that's carrying the sperm from the cremasteric pouches, from the testes, up around the lateral ligaments of the bladder, and then going down into the pelvic cavity and inserting or opening up into the urethra at about this point here, where there's kind of a swelling in the urethra. And this is where the prostate gland is. And they have other glands identified for this pathway, seminal vesicles and bulbourethral glands. And don't worry about finding those, because we won't be able to really see those in these guys. Yeah. And so those are associated with that vas deferens or ductus deferens where it dumps in, but it dumps in it usually travels right through the prostate, which is why people with prostate hypertrophy have problems urinating, because it compresses the urethra and makes it difficult to urinate in any volume. And that's located right here, which you can see where I've cut away at the pelvic girdle. That's in the pelvic cavity. But the urethra, which is carrying the urinary products like we talked about with the female, but is also, after this point, carrying the sperm and seminal fluids, then travels out through the penis, and this is the shaft of the penis, which is attached by muscle and connective tissue to the pubis and the ischium, then extends out just in between the two inguinal canals or cremasteric pouches, and then opens up here. And I have this is the hide, the skin, and then this is the shaft of the penis, and the head of the penis, or the glans penis, is surrounded by foreskin, which is a layer that curves back around. There's normally just a little aperture right here on your cats, and I cut that open and then expose this. And this is the prepuce, or foreskin, that I'm holding out now. And in between that is the glans penis, or the head of the penis. So at erection, that extends out this orifice or opening. Okay. Now, emasteric pouches, they sit in the scrotum, and so the scrotum is this thick sac that includes the hide on the outside, the skin and the dermal layers, and each cremasteric pouch is in a little pocket within that scrotum that's separated from each other, or the two pockets are separated by a septum scroti. and this is the septum that ran longitudinally or vertically between the two cremasteric pouches. Now, the tough connective tissue that makes up the septum and the wall of the scrotum under the hide is called the dartose tunic. So the dartose tunic is the thick layer that makes up the scrotum. In the cremasteric pouch, I've opened up this one, and on these guys it's tough to see the structures of the testis, but we're looking at those. This is the inside of the cremasteric pouch, and then this little thin sheet is in between the testis and associated structures and that dartose tunic. And that thin pouch is an extension of the abdominal wall. And so the layers of the abdominal wall, as the testis descends, push that evagination or that extension down into the scrotum. And so that cremasteric pouch, you can't tell it here, but it's got really 4 layers, counting the parietal lining of the abdominal wall. But the 3 layers of the abdominal wall are represented by the external spermatic fascia, the cremasteric muscle, and the internal spermatic fascia, in that order from outside to inside. And I'm holding all 3 of those in my forceps here. The lining on that pouch, the inner lining, is called the parietal tunica vaginalis, because vagina means sheath. And so this is called the processus vaginalis, or a preceding sheath. As the testes descend, it forms this little pocket that grows down into the scrotum. And so that's where you get the term processus vaginalis and tunica vaginalis, which are layers of that sheath. On the inside of the cremasteric pouch is the parietal tunica vaginalis. On the testis and epididymis and other structures is the visceral tunica vaginalis, just like the visceral peritoneum that lines the other organs in the cavity. And so that parietal and visceral tunica vaginalis are continuations of the visceral peritoneum and parietal peritoneum we talked about in here. Now, one last thing I'll mention, as that proceeds down and the testes descend, they drag the testicular artery and vein with them. And on this, even though they're not labeled, you can see from the inguinal opening or aperture on this side, here is the Ductus Deferens, which is coming out of the testes, and here is the testicular artery and vein that are all going down into that process and into the inguinal canal. And those collectively form the spermatic cord. Those 3 tubes that are going down into the cremasteric pouch are the spermatic cord. And that's a testicular artery to supply blood for the testes and a testicular vein to remove it, and the vas deferens or ductus deferens that's collecting sperm and seminal fluid from the testis and the epididymis, which you can see much better on the bull testes. And then the epididymis leads to the ductus deferens or vas deferens, which is going to carry the sperm and seminal fluid up and around and dump into the urethra at the prostate, which I described before. Got it? Okay.